Hi, good evening all. Welcome back to our Nursing Guru channel. So today this video is completely for post basic nursing students. So from yesterday we are conducting Navaratri special 9 nursing bites. So 9 nursing bites and now start ಮಾಡಿದೀವಿ ಎಸ್ಪೆಷಲಿ ಫಾರ್ ದ ನರ್ಸಿಂಗ್ ಸ್ಟೂಡೆಂಟ್ಸ್. ಸೊ ಈ 9 ಡೇಸ್ ನವರಾತ್ರಿ ಹೇಗೆ ಎಲ್ಲರಿಗೂ ಸ್ಪೆಷಲ್ ಹಾಗೆ ಈ 9 ಡೇಸ್ ಆಫ್ ನವರಾತ್ರಿಯಲ್ಲಿ ನರ್ಸಿಂಗ್ ಸ್ಟೂಡೆಂಟ್ಸ್ಗೂ ಕೂಡ ಸ್ವಲ್ಪ ಹೆಲ್ಪ್ ಆಗಲಿ. ಲೆಟ್ ನರ್ಸಿಂಗ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಬಿ ಹೆಲ್ಪ್ಫುಲ್ ಬೈ ದಿಸ್ 9 nursing days. So completely this video is for post basic nursing students. So in this video we are going to see the first year and second year subjects. So completely a course overview will be there. Subject overview, syllabus review, exam pattern, exam tips and tricks, and completely we are concluding this post basic crash course. So this is a crash course for the post basic nursing students. So if everyone is ready, let's start our crash course for post basic nursing students. I hope everyone are ready. Elru ready idira anta ankontini. So let's start. Okay. What is post basic BSc nursing overview? So ಇಲ್ಲಿ ಏನ್ ನೋಡ್ತೀವಿ? What's the duration of this post basic nursing course? So it is 2 years. So duration of this course is 2 years. What is the eligibility? So eligibility ಏನು? That is GNM completion with 1 year experience. Student should be completed GNM course and they should have 1 year experience. So GNM complete ಆಗಿರ್ಬೇಕು, 1 ವರ್ಷ experience ಇರಬೇಕು. So what's the main aim of this post basic BSc nursing course? So ಏನು ಇದರ main aim ಅಂತ ಅಂದ್ರೆ to prepare nurses who can provide safe, competent and effective nursing care at hospitals and in the community. So it's completely to prepare the nurses provide safe, competent and effective nursing care at hospitals and even in the community. Then what are the focus areas? So what might be the focus areas here? That is fundamental nursing skills. Mainly focus on fundamental nursing skills. Community health, even community health allu kuda idu focus ಆಗಿರುತ್ತೆ, ಇದು ಕೂಡ important. Then midwifery, especially gynecological nursing. So completely ಈ midwifery ಮತ್ತೆ gynecological nursing ಮೇಲೆ ಇದು focus ಆಗಿರುತ್ತೆ. Medical surgical nursing based on some medical conditions, surgical conditions ಆಗಿರ್ಬೋದು, ಈ ತರದ್ರಲ್ಲಿ ಇದು focus ಆಗಿರುತ್ತೆ. Then based on the pediatric, psychiatric and advanced nursing. So based on the children, so pediatric field, psychiatric field, especially in the mental health field. Then advanced nursing. So based on the advanced nursing, this post basic BSc nursing has focused. Then it is focused on educational institutions. Even you can see, so after post basic BSc nursing, so they can work in the educational institutions. Then what are the career opportunities? So ಏನೆಲ್ಲ career opportunities ಇದೆ? So after post basic nursing ಏನ್ career opportunities ಇದೆ, ಏನ್ ಆಗ್ಬೋದು, ಲೈಕ್ ಏನೇನ್ ಯಾವ್ಯಾವ ಫೀಲ್ಡ್ ನಲ್ಲಿ ನಾವು ಹೋಗ್ಬೋದು ಅಂತ ಕೇಳಿದ್ರೆ, so mainly staff nurse. So in hospital settings, the post basic BSc nursing students can work as a staff nurse ಆಗಿ work ಮಾಡ್ಬೋದು. Community health nurse ಆಗಿ community sector ಅಲ್ಲಿ, so based on the community health nurse, he or she can work in the community field. School health nurse, so school health nurse ಆಗಿ work ಮಾಡ್ಬೋದು. Based on the military nurse, so she can work in the military field. Nursing tutor can work as a nursing tutor, can even work as an educator and even higher studies kuda ಮಾಡಬಹುದು. That is MSc nursing. So this is an overview of this post basic BSc nursing. So ಇದು ನಮ್ಮ post basic course ಆಗಿದೆ. Okay, let's move on to the subject overview. So what are the subjects we can see in this first year? First year ಅಲ್ಲಿ ಏನೇನೆಲ್ಲ subjects ಇದೆ? What are the subjects here? So you can see nursing foundation ಇದೆ, nutrition and dietetics, biochemistry and biophysics, psychology, microbiology, maternal nursing, child health nursing, medical and surgical nursing, and English. So English will also be a subject here. So these are the important, mainly there are only 8 subjects. English ಕೂಡ include ಆಗಿದೆ. So ways to learn grammar ಈ ತರ things ಗೆ ನಾವು English ನ include ಮಾಡಿದೀವಿ. According to the university, mainly 8 subjects ಇದೆ first year post basic BSc nursing ಅಲ್ಲಿ. So mainly there are 8 subjects. Got it? Yes. Then nursing foundation. So ಈ 8 subjects, all these 8 subjects are been given separately here. So let's see these 8 subjects in detail again. So nursing foundation. In nursing foundation, there are mainly 7 units. So the first unit is development of nursing as a profession. So the first one bitu development nursing as a profession ಹೇಗೆ ಅಂತ ನಾವು ತಿಳ್ಕೊತೀವಿ. The second is ethical, legal and other issues in nursing. So what are the ethical issues? What are the legal issues? These types of issues are seen in the second unit. Then third unit. So what is third unit? Theory of nursing practice. So ಏನೇನೆಲ್ಲ theories ಇದೆ? What type of theories are includes in nursing practice? So ಅದನ್ನ ನಾವು third unit ಅಲ್ಲಿ ಕಲಿತೀವಿ. Next fourth unit is nursing process. What is nursing process? What includes a nursing process? ಇದು ಕಂಪ್ಲೀಟ್ ಆಗಿ ನರ್ಸಿಂಗ್ ಕೇರ್ ಪ್ಲಾನ್ ಆಗಿರ್ಬೋದು, ನರ್ಸಿಂಗ್ ಪ್ರಾಸೆಸ್ ಆಗಿರ್ಬೋದು, ಕಂಪ್ಲೀಟ್ ಹೇಗೆ ಅಸೆಸ್ ಮಾಡಬೇಕು, ಹೌ ಟು ಅಸೆಸ್, ಹೌ ಟು ಇಂಟರ್ವೆಂಟ್, ಹೌ ಟು ಇಂಪ್ಲಿಮೆಂಟ್, ಹೌ ಟು ಇವ್ಯಾಲ್ಯುಯೇಟ್ ದ ಪೇಷಂಟ್ಸ್, ಈ ಎವ್ರಿಥಿಂಗ್ ಕಂಪ್ಲೀಟ್ಲಿ ನಾವು ಈ ಫೋರ್ತ್ ಯೂನಿಟ್ ಅಲ್ಲಿ ಕಲಿತೀವಿ. Then fifth unit is quality assurance, nursing standards, nursing audit, total quality management. So in this fifth unit, we are going to see nursing standards of nursing, nursing audit. Even we will see nursing audit. Then total quality of management. So the entire total quality of management ನಾವು fifth unit ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then what about sixth unit? Sixth unit is very important. Primary healthcare concept. Here in the sixth unit, so nursing foundation is giving that primary healthcare concept. So PHC ಏನು, family oriented nursing concept, completely family oriented nursing concept. What is family? What is the nursing care in the family? Then what is primary health care? So primary health care ಅಂದ್ರೆ ಏನು, family oriented nursing concept ಅಂದ್ರೆ ಏನು. So this completely comes under unit number 6. Then what about unit 7? That is biomedical waste management. So how to discard waste, have to use it. So especially ಇದನ್ನ ನಾವು hospital settings ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. We mainly look this in hospital settings, that is biomedical waste management. So how to discard the needles, how to discard the ampoules, how to discard the vials, how to discard the urinary bags, urinary catheters, how to discard the soiled objects like cotton, gauze, etc. So completely this comes under, and how to segregate that. ಅದನ್ನ ಎಲ್ಲದನ್ನು ನಾವು biomedical waste management ಈ ಒಂದು ಯೂನಿಟ್ ಅಲ್ಲಿ ನೋಡ್ತೇವೆ. Okay, the next subject is nutrition and dietetics. So what is this nutrition and dietetics? This mainly concentrates on 4 units. In nutrition and dietetics, there are mainly 4 units. That is introduction to nursing and dietetics. So nutrition, what is nutrition? What is dietetics? So this completely comes in this unit number 1. Then unit number 2, introduction to diet therapy. So we know there are many types of therapy. So this mainly in this unit we focus on the diet therapy, that is introduction to diet therapy. ಏನೇನೆಲ್ಲ ಡಯಟ್ ಕೊಡಬೇಕು, ಯಾವ ತರ we need to follow the diet to the patient. So ಇದು completely unit number 2 ಅಲ್ಲಿ ಇರುತ್ತೆ. Then unit 3 is infant and child nutrition. Yes, this is very important because child should get proper nutrition at proper time. So that is infant and child nutrition. ಯಾವ ಟೈಮಲ್ಲಿ ಯಾವ ತರ ನ್ಯೂಟ್ರಿಷನ್ ಕೊಡಬೇಕು, at what age what nutrition should be followed, what diet should be followed in the children's and the infants. That explains this third unit. And the fourth unit is community nutrition, need for community nutrition program. So what is community nutrition? Community nutrition andre ಏನು, community nutrition program, what type of programs have held by government to improve the community nutrition? Those completely we are going to see in this fourth unit, that is community nutrition. Then the next subject is biochemistry and biophysics. So this biochemistry and biophysics is divided into section A and section B. Got it? So let's see what is section A. So in this section A, that we mainly focus on introduction, importance of the biochemistry in nursing. So what is the importance of biochemistry in nursing? That we see in this unit number 1. Then unit number 2 is water and electrolytes. So what is water? What are electrolytes? There are n number of electrolytes like calcium, magnesium, potassium. ಇದರ ಎಲ್ಲದರ ಬಗ್ಗೆ ನಾವು water and electrolytes ಅಲ್ಲಿ ಕಲಿತೀವಿ. Then enzymes. So we will even study about the enzymes. Then carbohydrates. Yes, carbohydrates are also very important. So we are going to study about carbohydrates in unit number 4. Then unit number 5 is protein. So protein includes like amino acids, hormones, etc. So detailedly we will study about the amino acids and hormones. Then unit 6 is biosynthesis of fats and storage of fats in the body. So what are biosynthesis of fats? What are fats? How these fats are stored in our body? ಇದನ್ನ ನಾವು 6th unit ಅಲ್ಲಿ ಕಲಿತೀವಿ. That completely we study in 6th unit. What are fats? How these fats are stored in our body. Then the last, biomedical waste management. Yes, in all the sectors you will gonna see this biomedical waste management. Yes. Next, section B is biophysics. So, what is biophysics? Physics ಅಂದಕ್ಷಣ ನಮ್ಮ ತಲೆಗೆ ಬರೋದು. What comes when we see the word physics? Gravity, force, work, energy, heat, light, pressure, etc. So, this only comes to our mind when we hear the word called physics. The same things comes here, that is biophysics, dealing with biology and physics, combination of this biology and physics. So let's see what is that. So means how this physics is working in the nursing field, or what is the main importance of this physics in the nursing field, why we need physics in the nursing field, ಅದನ್ನ ನಾವು biophysics ಅಲ್ಲಿ ಕಲಿತೀವಿ. So first introduction, concept of unit and measurements. Yes, unit and measurement is very important in nursing field. Then vector in scalar motion, speed, velocity, acceleration, gravity, so force, work, energy, heat, light, pressures, sound, electricity, electromagnetism, atomic energy, principles of electronics. These completely comes under biophysics. ಇದೆಲ್ಲ ಒಂದೊಂದು ಸಪ್ರೇಟ್ ಆಗಿ ನಾವು ಓದ್ತೀವಿ ಕಂಪ್ಲೀಟ್ಲಿ. ದೀಸ್ ಆರ್ divided into units. Gravity is a chapter, force, work, energy is also a separate unit, heat is separate unit, light is separate units. So this completely, these are separate units. ಇದೆಲ್ಲದನ್ನು ನಾವು ಡೀಟೇಲ್ಡ್ ಆಗಿ biophysics ಅಲ್ಲಿ ಕಲಿತೀವಿ. That is section B, biophysics. Next is psychology. Yes, psychology is a very important subject in the nursing field because to understand the patient's mentality. So it is very important to understand the patient mentality. So this psychology is very important. First is introduction. What is psychology? There are some definitions of psychology. There are some theories. So completely this we will study in introduction. Then sensation and attention and perception. So sensation andre ಏನು? What is attention? There are types of attention. How this attention affects the patient? What are the factors affecting attention? What is perception? So what are the types of perception? Which factors influence the patient in the perception? This completely we're gonna say in the second unit. Then motivation. Yes, what is motivation? There are some types of motivation. So these comes under unit 3. Then emotions. So what are emotions? So how emotions affect the patient? So what type of emotions the patient consists? So that we will see in the unit number 4. Then unit 5 is personality. So what is personality? So how this personality affects, how this changes, how this grows. ಇದನ್ನ ನಾವು unit 5 ಅಲ್ಲಿ ಕಲಿತೀವಿ. Then psychological aspects of nursing is a 6th unit. So psychological aspect of nursing means what, how the psychology is getting improved, how the psychology will affect the nursing field. So next 7th is individual differences. Yes, we know each and every individual is different. Each and every individual is having different individual differences. Is it or not? So you're not similar like me. You don't think similar like me. So that is called individual difference. You have different mentalities. I have different mentalities. So that is individual differences. Then unit number 8 is intelligence and ability. So what is intelligence? What are the abilities? Those things we will see in unit number 8. Then unit number 9, that is learning. Learning, types of learning. So entirely the learning process we are going to see in unit number 9. Then memory and forgetting. What is memory and forgetting? Memory andre enu? How this memory comes, that means how this memory is affecting our human body, how this memory stays in our mind. So that completely we will see in memory and forgetting. ಅಂದ್ರೆ ಎಷ್ಟು ಟೈಮ್ ತನಕ ಒಬ್ಬ ಪರ್ಸನ್ ಹೇಳಿರುವಂತ ಒಂದು ವರ್ಡ್ ನ ಮೆಮರೈಸ್ ಮಾಡುವುದು, at till what time the person can memorize. So there are many types, short term memory, long term memory. So that we're gonna see in this memory and forgetting. Then attitudes. Yes, attitudes means it's a very important concept we know. So attitudes is very important. Then we'll see different types of attitudes here. That is unit number 11, attitudes. Then unit number 12 is concept of mental hygiene and mental health. So what is mental hygiene? What is mental health? So that completely we're going to see in this unit number 12. Next, the subject is microbiology. So, what is microbiology? It is dealing with the microorganisms. So, here we are going to see structure and classification of microbes in the first unit. The first unit is structure and classification of the microbes. So, what's the structure of microbes? So, how these microbes are classified? That we're going to see in the first unit. And the second unit is identification of microorganisms. How we're going to identify the microorganisms. Then the next unit is, that is third unit, growth and nutrition of microbes. So what is growth? What is nutrition? So that we're gonna see in this microbiology means growth and nutrition of the microbes. How the microorganisms takes birth, how the microorganisms grow, how they get nutrition. That we're gonna see in this third unit. Then, destruction of the microorganisms. Now, how to destroy the microorganisms? There are many types to destroy microorganisms that we're going to see in the fourth unit. And the fifth unit is disease producing microorganisms. So, what type of disease will be produced by the microorganisms? So, that we will see in the fifth unit. Means, for example, if a bacteria is there, so what type of disease that bacteria causes? ಅದನ್ನ ನಾವು fifth unit ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then the sixth unit is pathogenic fungi. So pathogenic fungi means completely fungus ಬಗ್ಗೆ ನಾವು ಆ sixth unit ಅಲ್ಲಿ study ಮಾಡ್ತೀವಿ. Then the seventh unit is immunity. So what is immunity? What is immunization? What is immunization schedule? ಅದನ್ನ ನಾವು seventh unit ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. There are types of immunity, innate immunity, acquired immunity ಇದೆಲ್ಲ ಇದೆ. ಸೊ ಅದನ್ನ ನಾವು seventh unit ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. ಇನ್ನು eighth unit parasites and vectors. So what is parasites? What are vectors? That we will see in the unit number 8. Unit 9 is completely based on the virus. There are different types of virus affects our human body. That means different types of microorganisms affects our human body. ಅದನ್ನ ನಾವು unit number 9 ನಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 10 is microorganisms transmitted through food. So what microorganisms transmit through the food, or which microorganisms are transmitting through the food? So which microorganisms are affecting us through the food? ಅದನ್ನ ನಾವು unit 10 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. The same unit 11, that's biomedical waste management. Next it is maternal nursing, that is midwifery, or it also a gynecological nursing. So what is maternal nursing? The first unit we will gonna see that introduction and historical review. So introduction means maternal nursing andre ಏನು? What is maternal nursing? Why we are studying maternal nursing? What is the importance of this maternal nursing? What is the main aim of this maternal nursing? What is the nursing management in the maternal nursing? ಇದನ್ನ completely ನಾವು introduction and historical review ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Next, review of the anatomy and physiology of the female reproductive system. So what is female reproductive system? Anatomy of the complete female reproductive system. ಏನೆಲ್ಲ organs ಇದೆ? So what's the function of the female reproductive system? What organs are present in the female reproductive system? That we're going to see in this maternal nursing review of anatomy and physiology. The third unit is physiology of pregnancy. So how pregnancy occurs? What is the stages of pregnancy? So during that 9 months, what the female is going to suffer, means what the female is going to affect them. That means how this pregnancy is affecting the female body and how the pregnancy goes on. That completely we're gonna see in this unit number 3 is physiology of pregnancy. Then the newborn baby. Yes, it's very important. After the pregnancy, the next step is a newborn baby. So the complete newborn baby. What is newborn baby? So what might be the weight? What is the height? Then what is the head circumference, chest circumference? Already we have studied this in the child health nursing too. Although we will study here the newborn baby, how to care a newborn baby. So that completely we will say in this unit number 4. Then management of abnormal pregnancy, labor and puerperium. So management of the abnormal pregnancy. So if the female is having an abnormal pregnancy, have to manage that. Then have to manage the labor. Then have to manage the postpartum period. Puerperium means after the delivery. So have to manage all these situations. Have to manage all these conditions that we're gonna see in this unit number. Yes. Then unit 6 is Drugs in obstetrics. So in this obstetrics, what types of drugs we are going to use? So oxytocin ಏನು ಯೂಸ್ ಮಾಡ್ತೀವಿ, ವೈ ವಿ ಯೂಸ್ ದಟ್, ಅದೆಲ್ಲದರ ಬಗ್ಗೆ ನಾವು ದಿಸ್ ಯೂನಿಟ್ 6 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. ದೆನ್ ಯೂನಿಟ್ 7 ಇಸ್ ನ್ಯಾಷನಲ್ ವೆಲ್ಫೇರ್ ಪ್ರೋಗ್ರಾಮ್ಸ್ ಫಾರ್ ವುಮೆನ್. Yes, our Indian nation has implemented many welfare programs for the women. We know this. So that welfare programs we're gonna see in this seventh unit, that is national welfare programs for women. That is maternal nursing. Then the next subject is child health nursing. So in child health nursing ಅಲ್ಲಿ ಏನ್ ಕಲಿತೀವಿ? Already we know in the maternal nursing we have seen the newborn baby. So in this child health nursing, same thing comes. So what is child? What is a healthy child? How to care a neonates? ಅದನ್ನ ನಾವು ಈ ಚೈಲ್ಡ್ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್ ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. ಸೊ ನ್ಯೂ ಬಾರ್ನ್ ಬೇಬಿನ ಹೇಗೆ ಕೇರ್ ಮಾಡೋದು. ಸೊ ಚಿಲ್ಡ್ರನ್ಸ್ ಸರ್ಟನ್ ಏಜ್ ಅಲ್ಲಿ ಚಿಲ್ಡ್ರನ್ಸ್ ಡೆವಲಪ್ಮೆಂಟ್ ಏನಾಗಿರುತ್ತೆ, ಚಿಲ್ಡ್ರನ್ಸ್ ಹೇಗೆ ಡೆವಲಪ್ ಆಗ್ತಾರೆ, ಚಿಲ್ಡ್ರನ್ಸ್ ಅಲ್ಲಿ ಏನೇನ್ ಯಾವ ತರ ಫುಡ್ ಕೊಡ್ಬೇಕು, ಏನ್ ಚೇಂಜಸ್ ನೋಡ್ತೀವಿ, ಯಾವ ತರ ಡಿಸೀಸಸ್ ಇರುತ್ತೆ, ದಟ್ ಕಂಪ್ಲೀಟ್ಲಿ ವಿ ಸಿ ಇನ್ ದಿಸ್ child health nursing. That is unit 1, introduction. So completely introduction of child health nursing will be seen. Then the healthy child. What is healthy child? Healthy newborn child or healthy growing child. ಅದನ್ನ ನಾವು ಯೂನಿಟ್ 2 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 3 is nursing care of a neonate. How to care a neonate. How to care a newborn baby. That we will see in the unit number 3. Unit 4 is nursing management in common childhood diseases. So, common childhood diseases in the what are the common childhood diseases and how the nursing management occurs. ನಾವು ಯಾವ ತರ ನರ್ಸಿಂಗ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಮಾಡ್ತೀವಿ, ಸೊ ಹೌ ಟು ಕೇರ್ ದ ಕಾಮನ್ ಚೈಲ್ಡ್ಹುಡ್ ಡಿಸೀಸಸ್, ಅದನ್ನ ನಾವು ಯೂನಿಟ್ 4 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. ದೆನ್ ಯೂನಿಟ್ 5, management of behavioral disorders in children. So behavioral disorders, there will be some behavioral disorders, right? So ಅದನ್ನ ನಾವು ಯಾವ ತರ ಕೇರ್ ಮಾಡ್ತೀವಿ, how to manage that. So that behavioral disorders in children, ಅದು means after the birth we will come to know that child is having some behavioral disorders. So that behavioral disorder children, how you gonna care, that is how you gonna manage that child. So that is management of behavior disorders in children. Yes, the next subject is medical surgical nursing. So what is medical surgical nursing? Introduction to medical surgical nursing, that we see in unit 1, introduction to medical surgical nursing. Then we see nursing management of patient with specific problems, how to care or how to manage the specific problems patients. So some patients will be having some specific problems, ಅದನ್ನ ನಾವು ಯಾವ ತರ ಕೇರ್ ಮಾಡ್ತೀವಿ. Then nursing management, how to care the patient with neurological problems or neurosurgical conditions, that is unit 3. Then unit 4 is how to care the patient with the cardiovascular system. Unit 5 is based on the respiratory system and unit 6 is based on the urinary system. ಇದು ಕಂಪ್ಲೀಟ್ಲಿ ಮೆಡಿಕಲ್ ಸರ್ಜಿಕಲ್ ನರ್ಸಿಂಗ್ ಅಲ್ಲಿ ಏನ್ ಕರಿತೀವಿ ಅಂದ್ರೆ ಕಂಪ್ಲೀಟ್ ನರ್ಸಿಂಗ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ನ ಕಲಿತೀವಿ. ಸೊ ಹೌ ಟು ಕೇರ್, ಸೊ ವಾಟ್ ಇಸ್ nursing management, how to care the situation, how to care the conditions, how to treat the patient. So based on the neurological conditions ಆಗಿರ್ಬೋದು, cardiovascular problems ಆಗಿರ್ಬೋದು, respiratory problems ಆಗಿರ್ಬೋದು, urinary problems ಆಗಿರ್ಬೋದು. ಸೊ ಈ ತರ ಕಂಡೀಷನ್ಸ್ ಇರುವಂತ ಪೇಷಂಟ್ಸ್ ನಾವು ಯಾವ ತರ ನರ್ಸಿಂಗ್ ಕೇರ್ ಕೊಡ್ತೀವಿ, ಯಾವ ತರ ನರ್ಸಿಂಗ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಮಾಡ್ತೀವಿ, ಅದನ್ನ ನಾವು ಮೆಡಿಕಲ್ ಸರ್ಜಿಕಲ್ ನರ್ಸಿಂಗ್ ಅಲ್ಲಿ ಕೇಳ್ತೀವಿ. ಅಂಡ್ ರಿಮೈನಿಂಗ್ ಯೂನಿಟ್ಸ್ ಲೈಕ್ ಡೈಜೆಸ್ಟಿವ್ ಸಿಸ್ಟಮ್ ಅಲ್ಲಿ ಯಾವ ತರ ಪ್ರಾಬ್ಲಮ್ಸ್ ಇದೆ, ಸೊ ಅದನ್ನ ನಾವು ಯಾವ ತರ ಕೇರ್ ಮಾಡ್ಬೋದು. ದೆನ್ ಇಸ್ ಎಂಡೋಕ್ರೈನ್ ಪ್ರಾಬ್ಲಮ್ಸ್, ಹೌ ಟು ಕೇರ್ ದ ಪೇಷಂಟ್ ವಿತ್ endocrine problems. Then how to care the patients with musculoskeletal problems. So some patients will be having the musculoskeletal problems, ಅದನ್ನ ಯಾವ ತರ ಕೇರ್ ಮಾಡಬೇಕು, ಯಾವ ತರ ಟ್ರೀಟ್ ಮಾಡಬೇಕು, ಯಾವ ತರ ನರ್ಸಿಂಗ್ ಕೇರ್ ಕೊಡಬೇಕು, that we will see here. That will study here. Then the nursing management of patients with the disorders of female reproductive tract. So female reproductive tract ಅಲ್ಲಿ ಯಾವ್ದಾದ್ರು disorders ಇದ್ರೆ, so if any disorders affects that, so how to care, how to give a nursing management, that we'll see in the unit 10. Then unit 11 is based on the nursing management of patients with the same reproductive tract. Then the nursing management of patients with the births, how to ಕೇರ್ ದ ಬರ್ನ್ ಪೇಷಂಟ್ಸ್. ಒಂದು ಮೇಲ್ ರಿಪ್ರೊಡಕ್ಟಿವ್ ಸಿಸ್ಟಮ್ ನ ಹೇಗೆ ನೋಡ್ತೀವಿ, ಫಿಮೇಲ್ ರಿಪ್ರೊಡಕ್ಟಿವ್ ಸಿಸ್ಟಮ್ ನ ಹೇಗೆ ಕೇರ್ ಮಾಡ್ತೀವಿ, ದೆನ್ ದ ನರ್ಸಿಂಗ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆಫ್ ದ ಪೇಷಂಟ್ಸ್ ವಿತ್ ದ ಬರ್ನ್ಸ್. ದೆರ್ ಆರ್ ಮೇನ್ಲಿ 12 ಯೂನಿಟ್ಸ್, ನಿಮಗೆ ಆಲ್ರೆಡಿ ಹೇಳಿರೋ ತರ. ಸೊ ಈ ಸ್ಲೈಡ್ ಅಲ್ಲಿ 6 ಇದೆ, ಇಲ್ಲಿ 6 ಯೂನಿಟ್ಸ್ ಇದೆ. So this is completely 12 units medical surgical nursing. So this completely is based on how to treat, how to give a nursing management, how to give a nursing care to the patient. Then yes, the last thing is English. Why English is important? Because English ನಾವು ಎಕ್ಸಾಮ್ ಪೇಪರ್ ಪ್ರೆಸೆಂಟ್ ಮಾಡೋದು ಇಂಗ್ಲಿಷ್ ಅಲ್ಲಿ. ಸೊ ರೆಮಿಡಿಯಲ್ ಸ್ಟಡಿ ಆಫ್ ಗ್ರಾಮರ್. ಸೊ ಗ್ರಾಮರ್ ಕರೆಕ್ಷನ್ಸ್, ಗ್ರಾಮರ್ನ ಕಲಿಸ್ತಾರೆ. ಸೊ ಗ್ರಾಮರ್ನ ಕಲಿಬಹುದು. ದ ಎಬಿಲಿಟಿ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ಸೆಲೆಕ್ಟೆಡ್ ಪ್ಯಾಸೇಜ್ ಅಂಡ್ ಎಕ್ಸ್ಪ್ರೆಸ್ ಮೀನಿಂಗ್ ಇನ್ ಒನ್ಸ್ ಓನ್ ವರ್ಡ್ಸ್. ಸೊ this English will help us to understand the selected passage and express meaning in one's own words. ನಮ್ಮ ಸ್ವಂತ ಲ್ಯಾಂಗ್ವೇಜ್ ಅಲ್ಲಿ, ನಮ್ಮ ಸ್ವಂತ ವರ್ಡ್ಸ್ ಅಲ್ಲಿ ನಾವು ಯಾವ ತರ ಎಕ್ಸ್ಪ್ರೆಸ್ ಮಾಡಬಹುದು ಅನ್ನೋದನ್ನ ನಮ್ಗೆ ಇಲ್ಲಿ ಹೇಳ್ಕೊಡ್ತಾರೆ. ದೆನ್ ದ ಸ್ಟಡಿ ಆಫ್ ವೇರಿಯಸ್ ಫಾರ್ಮ್ಸ್ ಆಫ್ ಕಾಂಪೋಸಿಷನ್. Then verbal communication means communication is very important in the nursing department or in the nursing field. So our verbal communication ಯಾವ ತರ ಇರಬೇಕು, what is verbal communication, how to speak with the patient, how to interact with the patient, ಅದನ್ನ ನಾವು ಯೂನಿಟ್ 4 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. ದೆನ್ ಎಸ್, ದಿಸ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ತುಂಬಾ ಜನಕ್ಕೆ ಕ್ವಶನ್ ಪೇಪರ್ ಯಾವ ತರ ಇರುತ್ತೆ ಅಂತ ಗೊತ್ತಿರಲ್ಲ. ಸೊ ಪೋಸ್ಟ್ ಬೇಸಿಕ್, ಇವಾಗಿನ್ನು ಪೋಸ್ಟ್ ಬೇಸಿಕ್ ಅಡ್ಮಿಷನ್ ಹೋಗ್ತಿರ್ತೀರಾ. ಸೊ ಯು ಅಪ್ ಟು ಗಿವ್ ಯುವರ್ ಫಸ್ಟ್ ಇಯರ್ BSc nursing. That means first year post BSc nursing exams. You would have not know this, how the question paper comes. So what type of questions might come. So this is a question paper here. So see, long essay, there will be 3 long essays. You have to write only 2. So only two you have to write. Among 3, you are gonna answer only to 2 questions. Adu long essay, there will be for 20 marks. Per question 10 marks irutte. Sorry to tell, ನಾನು ಮುಂಚೆ ಹೇಳಬೇಕಿತ್ತು, forgot to tell. Paper 3 hours ಗೆ ಇರುತ್ತೆ. There will be 3 hours session. That means a 3 hours exam time. Then the total marks is 100 marks ಇರುತ್ತೆ paper. But you will write only for 75 marks. Only for 75 marks you're gonna write. And remaining 25 ಏನಪ್ಪಾ ಅಂತಂದ್ರೆ that is completely your internal marks. Okay na? So ನಿಮ್ಮ internal marks ಆಗಿರುತ್ತೆ. So 25 based on your assignments, based on your behavior, based on your ಡ್ರೆಸ್ಸಿಂಗ್ ಸೆನ್ಸ್, ಬೇಸ್ಡ್ ಹೌ ಯಾವ ತರ ನೀವು ವೈವಾ ಕೊಡ್ತೀರಾ, ಆನ್ಸರ್ಸ್ ಯಾವ ತರ ಮಾಡ್ತೀರಾ, ನಿಮ್ ರೆಕಾರ್ಡ್ಸ್ ಕಂಪ್ಲೀಟ್ ಆಗಿದೆಯಾ, ಪ್ರಾಪರ್ ಟೈಮ್ಗೆ ಇನ್ ಟೈಮ್ಗೆ ಅಸೈನ್ಮೆಂಟ್ಸ್ ಕೊಡ್ತಿದ್ದೀರಾ, ಇನ್ ಟೈಮ್ಗೆ ನೀವು ಕೇರ್ ಪ್ಲಾನ್ಸ್ ಎಲ್ಲ ಸಬ್ಮಿಟ್ ಮಾಡಿದ್ದೀರಾ. ಸೊ ಇದು ಕಂಪ್ಲೀಟ್ಲಿ ನಿಮ್ಮ ಇಂಟರ್ನಲ್ ಮಾರ್ಕ್ಸ್ ಆಗಿರುತ್ತೆ. ಅಂಡ್ ಹೌ ನೀವು IAS ನ ಹೇಗೆ ಕೊಡ್ತಿದ್ದೀರಾ, ಸೊ ವೆದರ್ IAS ನ ಕೊಡ್ತಿದ್ದೀರಾ ಇಲ್ವಾ, ಸೊ ದಟ್ ಮೀನ್ಸ್ ಇಂಟರ್ನಲ್ ಅಸೆಸ್ಮೆಂಟ್ಸ್ ನ ಮಾಡ್ತಿದ್ದೀರಾ ಇಲ್ವಾ, ಪ್ರಾಪರ್ ಆಗಿ ನೀವು ರೂಲ್ಸ್ ಅಂಡ್ ರೆಗ್ಯುಲೇಷನ್ಸ್ ನ ಫಾಲೋ ಮಾಡ್ತಿದ್ರಾ ಇಲ್ವಾ, ಎಷ್ಟು ನೀವು ಸಿನ್ಸಿಯರ್ ಆಗಿದ್ದೀರಾ, ಇದು ಕಂಪ್ಲೀಟ್ಲಿ ದಟ್ ವಿಲ್ ಡಿಸೈಡ್ ಯುವರ್ ಇಂಟರ್ನಲ್ ಮಾರ್ಕ್ಸ್. ಅದು 25 ಮಾರ್ಕ್ಸ್ಗೆ ಇರುತ್ತೆ. ಅದನ್ನ ನಿಮ್ಮ ಕಾಲೇಜಲ್ಲಿ ನಿಮ್ಗೆ ನಿಮ್ಮ ಕ್ಲಾಸ್ ಇಂದ ಸಿಗುತ್ತೆ. ಅದು ದಟ್ ಮೀನ್ಸ್ ನಿಮ್ ಕಾಲೇಜಲ್ಲಿ ನಿಮ್ಗೆ ಅದನ್ನ ಕೊಡ್ತಾರೆ. ದಟ್ ಇಸ್ 25 ಮಾರ್ಕ್ಸ್. ಅಂಡ್ 75 ಮಾರ್ಕ್ಸ್ ಅನ್ನ ನೀವು ಬರೆದು ತಗೋಬೇಕಾಗುತ್ತೆ. ದಿಸ್ ಇಸ್ ರಿಟನ್ ಮಾರ್ಕ್ಸ್. 75 ಇಸ್ ರಿಟನ್ ಮಾರ್ಕ್ಸ್. ಓಕೆ. ದೆನ್ long essays, ಇಲ್ಲಿ 3 long essays ಇರುತ್ತೆ. You have to write only 2. There will be 3, you have to write only 2. That is per question 10 marks. Long essay 20 marks ಆಯ್ತು. Next, short essay. There will be 9 questions. Okay, you have to write only 7. 9 ಇರುತ್ತೆ, you have to attend only 7. Per question 5 marks. So per head ಏನಾಗುತ್ತೆ, per question 5 marks ಇರುತ್ತೆ. ಸೊ ಅಲ್ಲಿ 35 marks ಆಗುತ್ತೆ. ಸೊ ಟೋಟಲ್ ಇಲ್ಲಿ 55 marks ಆಯ್ತು, ಲಾಂಗ್ ಎಸ್ಸೆ ಮತ್ತೆ ಶಾರ್ಟ್ ಎಸ್ಸೆ ಸೇರಿ. Then the short answers. Then the last is short answers. 10 questions irutte. Per question 2 marks irutte. So that is 20 marks. Total allige 75 marks agirutte. Long essay alli 20 marks, short essay alli 35, and short answers alli 20 marks irutte. Yes, this was first year post basic nursing. First year students ಗೆ ಬೇಕಾಗಿರುವಂತಹ ಸಿಲೆಬಸ್ ರಿವ್ಯೂ ನ ನಾನು ಕೊಟ್ಟಿದ್ದೀನಿ. ಅಂಡ್ ಫಸ್ಟ್ ಇಯರ್ ಕ್ವಶನ್ ಪೇಪರ್ ನ ಕೂಡ ನಾನು ನಿಮ್ಗೆ ತೋರಿಸಿದ್ದೀನಿ ಯಾವ ತರ ಇರುತ್ತೆ ಅಂತ. ನಾವು ನೆಕ್ಸ್ಟ್ ಮೂವ್ ಆನ್ ಟು ದ ಸೆಕೆಂಡ್ ಇಯರ್. ಸೊ ಸೆಕೆಂಡ್ ಇಯರ್ ಅಲ್ಲಿ ಏನಿರುತ್ತೆ, ಸಿಮಿಲರ್ ನಿಮ್ಗೆ ಫಸ್ಟ್ ಇಯರ್ ಅಲ್ಲಿ ಯಾವ ತರ ಕ್ವಶನ್ ಪೇಪರ್ ಇರುತ್ತೆ ಅಲ್ಲ, ದ ಸೇಮ್ ಕೂಡ ಸೆಕೆಂಡ್ ಇಯರ್ ಅಲ್ಲಿ ಫಾಲೋ ಆಗುತ್ತೆ. ದರ್ ಇಸ್ ನೋ ಎನಿ ಚೇಂಜಸ್. ಸಬ್ಜೆಕ್ಟ್ಸ್ ಮಾತ್ರ ಚೇಂಜ್ ಆಗುತ್ತೆ. ಸಬ್ಜೆಕ್ಟ್ಸ್ ಯಾವ್ದು ಸಿಮಿಲರ್ ಇರಲ್ಲ, ಇಟ್ ಕಂಪ್ಲೀಟ್ಲಿ ಚೇಂಜ್ ಆಗಿರುತ್ತೆ. ಬಟ್ ದ ಪ್ಯಾಟರ್ನ್ ಏನಿರುತ್ತೆ ಫಸ್ಟ್ ಇಯರ್ ಮತ್ತೆ ಸೆಕೆಂಡ್ ಇಯರ್ಗೆ, ದ ಕಂಪ್ಲೀಟ್ಲಿ ಪ್ಯಾಟರ್ನ್ ಫಾರ್ ಫಸ್ಟ್ ಇಯರ್ ಅಂಡ್ ಸೆಕೆಂಡ್ ಇಯರ್ ಇಟ್ ವಿಲ್ ಬಿ ಸೇಮ್ ಪ್ಯಾಟರ್ನ್. ದರ್ ಇಸ್ ನೋ ಚೇಂಜಸ್ ಇನ್ ದ ಎಸ್ ಸೆಕೆಂಡ್ ಇಯರ್. ವಾಟ್ ಆಸ್ ಸೆಕೆಂಡ್ ಇಯರ್ ಪೋಸ್ಟ್ ಬೇಸಿಕ್ BSc ನರ್ಸಿಂಗ್ ಯಾವ ತರ ಇರುತ್ತೆ? ಸೊ ಇಲ್ಲಿ ನಾವು ಏನ್ ನೋಡ್ತೀವಿ, ಸಬ್ಜೆಕ್ಟ್ ಓವರ್ವ್ಯೂ. ಫಸ್ಟ್ ಸಬ್ಜೆಕ್ಟ್ ಓವರ್ವ್ಯೂ. ಸೊ ಯಾವ ತರ ಸಬ್ಜೆಕ್ಟ್ಸ್ ಇರುತ್ತೆ, ಸೋಶಿಯಾಲಜಿ ಇದೆ, ಕಮ್ಯುನಿಟಿ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್, ಮೆಂಟಲ್ ಹೆಲ್ತ್ ನರ್ಸಿಂಗ್, ಇಂಟ್ರೊಡಕ್ಷನ್ ಟು ನರ್ಸಿಂಗ್ ಎಜುಕೇಶನ್, ಇಂಟ್ರೊಡಕ್ಷನ್ ಟು ನರ್ಸಿಂಗ್ ಸರ್ವಿಸ್ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಷನ್, ಇಂಟ್ರೊಡಕ್ಷನ್ ಟು ನರ್ಸಿಂಗ್ ರಿಸರ್ಚ್ ಅಂಡ್ statistics. These will be the subjects in the second year. These are the main important subjects in second year. Okay, let's see the subjects one by one. The first subject, sociology. In sociology, we mainly have 7 units. Namge 7 units ಇದೆ. That is, first unit is introduction. What is sociology? So there are many definitions of sociology. ತುಂಬಾ authors ತುಂಬಾ definitions ನ ಕೊಟ್ಟಿದ್ದಾರೆ. So that we will see in the unit 1. Unit 2, individual and the society. What is individual and what is society? How individual behaves when he is alone and how he is in the society. ಅದನ್ನ ನಾವು unit 2 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 3 is completely based on culture. So we have a number of cultures here. That cultures we're gonna see in unit 3. Okay. Then unit 4 is social organization. Social organization ಅಂದ್ರೆ ಏನು, how it is organized, society, how society is organized. ಅದನ್ನ ನಾವು unit 4 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 5 is social process. So what is process? Social process, that completely we see it. So what is social process? How it affects, what is, how this affect in the society, that we gonna see in the unit 5. Then unit 6 is social change. Just a minute. Yes, in unit 5, social process. Then unit 6 is social change. What are the changes that occurs in the society? So that we're gonna see in the social changes. Then unit 7 is completely based on the social problems. So what are the social problems in the society? What are the problems in the society? That we're gonna see in unit 7. Then the next subject is community health nursing. So what is community health nursing? So first it is community health nursing andre enu, what is community health nursing, that we gonna see. Then introduction, the first unit is introduction. So what is community health nursing, how this affects, this we gonna see in the unit number 1. Then unit 2 is family health services. What are the family health services, what are the services are given, so what are the health services are provided to the family, that we're going to see in the unit number 2. Then unit 3 is organization and administration. So what is organization, what is administration, that we're going to see in unit number 3. That means the complete administration of the health services in India. ಇಂಡಿಯಾದಲ್ಲಿ ಯಾವ ತರ ಆರ್ಗನೈಸೇಷನ್ ಇದೆ, ಯಾವ ತರ ಅಡ್ಮಿನಿಸ್ಟ್ರೇಷನ್ ಇದೆ, ಅದನ್ನ ನಾವು ಯೂನಿಟ್ 3 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 4 is health education. So what is health education, that we gonna see in the unit number 4. Then unit 5 is a role of community health nurse. So what is role of community health nurse, what is the role of nurse in the community sector, that is unit number 5. Then sixth is epidemiology. Epidemiology means what are the types of, there are a number of diseases in the community. So how this affects. Then what are the communicable diseases? What are the non-communicable diseases? Those things we're gonna see in the unit number 6. Then unit 7 is biostatistics and the vital statistics. What are the biostatistics and what are the vital statistics? We're gonna see in the unit number 7. Then the subject is mental health nursing. So mental health nursing ಅಲ್ಲಿ ನಾವು mainly 10 units ಇದೆ. We mainly have 10 units. That is, the first unit is introduction and historical development. What is mental health nursing and how this, the complete history of the mental health nursing ನ ನಾವು first unit ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 2 is classification and assessment of the mental disorders. We will see the classification and the assessment of the mental disorders. ಯಾವ ತರ mental disorders ಇದೆ, how this mental disorders classified, then how we can assess the mental disorders, ಅದನ್ನ ನಾವು unit 2 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 3 is therapeutic communication. So what is therapeutic communication, ಅದನ್ನ ನಾವು ಇಲ್ಲಿ ನೋಡ್ತೀವಿ. Got it? In unit 3 therapeutic communication ನ ನೋಡ್ತೀವಿ. Then unit 4 ಅಲ್ಲಿ management of mental disorders, how to manage the mental disorders, how to treat the mental disorders ನ ನಾವು 4th unit ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 5, unit 5 ಅಲ್ಲಿ ಏನು, ethological factors, psychopathology ಅಂದ್ರೆ ಏನು, what are the type, clinical features, diagnostic criteria, treatment and nursing management of patient with the following disorders. So completely based on the disorders, based on the neurotic disorders, what are the etiological factors, what are the psychopathology, what are the types, what's pathophysiology, then what is the diagnostic criteria, what are the treatment, how you gonna treat, the how the nurses will treat, what's the nursing management, ಅದು ಕಂಪ್ಲೀಟ್ ಆಗಿ that completely we gonna see in the 5th unit. Then unit number 6 is management of patient with the substance use disorders. Yes, Management of patients with substance use disorders. So if the patient is using any substances, so if the patient gets some diseases with that substances, have to manage those patients. That we're gonna see in the unit number 6. Then unit 7 is management of mental subnormality. So how to manage the mental subnormality patients. ಅದನ್ನ ನಾವು 7th unit ಅಲ್ಲಿ ನೋಡ್ತೇವೆ. Then psychiatric emergencies. Unit 8 is psychiatric emergency. ಯಾವ ತರ psychiatric emergencies ಇದೆ, what type of emergencies ಇದೆ. ಸೊ ಅದನ್ನ ನಾವು unit 8 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Unit 9 is based on the therapeutic modalities. ಸೊ ಯಾವ ತರ therapeutic modalities ಇದೆ ಅದನ್ನ ನಾವು unit 9 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 10 is preventive psychiatry. How to prevent the psychiatric problems. And what is the prevention in the mental health nursing? What are the preventions in the psychiatry? ಅದನ್ನ ನಾವು unit 10 ನಲ್ಲಿ ನೋಡ್ತೇವೆ. Then introduction to nursing education. So this subject is also very important. So introduction to the nursing education. So what does this unit includes? This mainly includes 8 units. So each subject 8 units ಇದೆ. So first unit ಬಂದು introduction to education. Education. What is education? Why education is important? So it completely based on this education. Unit number 1. Unit 2 is teaching learning process. So what is teaching learning process? What is teaching? What is learning? Other completely how the process occurs, what is the process goes. So that completely we're gonna say in the unit number 2. Then unit 3 is methods of teaching. What are the methods of teaching? So each method, the lecture method is there, discussion method is there, demonstration methods is there. So there are many types of teaching, means many methods of teaching. That we're gonna see in the unit number 3. And unit 4 is educational media. What are the educational medias? ಯಾವ ತರ medias ಇದೆ ಅದನ್ನ ನಾವು unit 4 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 5 is methods of assessment. How to assess what type of methods are there in the assessment. That we're gonna see in unit number 5. Then unit 6 is management of school of nursing. So management of the school of nursing. School of nursing ಅಲ್ಲಿ ಯಾವ ತರ management ಇದೆ. So what's the management of the school of nursing? So how it is occurred means how it is framed. ಅದನ್ನ ನಾವು unit 6 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Then unit 7 is guidance and counseling. So guidance and counseling ಏನು ಅದು complete definition. Guidance ಅಂದ್ರೆ ಏನು, what is guidance, what is counseling, what are the definitions, what is the difference between guidance and counseling. That we're gonna see in the unit number 7. And unit 8 is in service education. In service education means while working, for example you are working in a hospital, along with that you need some education regarding your job or regarding your means what you are going to seek, that education you need. So that education is known as in service education. During the while working itself or while studying itself, you are taking some extra knowledge, you are taking some knowledge or you are taking some education, that is in service education. So this is introduction to nursing education. Then introduction to nursing service administration. Nursing service administration. So this is also in a subject in second year, that is introduction to nursing service administration. So really first unit ಬಂದಿದೆ. There are mainly 6 units. I hope so. Yes. 6 units ಇದೆ. So in this 6 units, the first unit is principles and practice of administration. What are the principles and what are the practices of the administration? We are gonna see in this first unit. And unit 2 is nursing unit management. So what is nursing unit management? Nursing unit and you have to manage. That completely we're gonna see in the unit number 2. Unit 3 is personal management. So what is personal management? Have to manage. So that we're gonna see in this unit number 3. Unit 4 is supervision. So subject ಹೇಳುತ್ತೆ nursing service administration. Completely is based on the administration field. Supervision. Have to supervise. How the nurse should supervise or how the ನರ್ಸಿಂಗ್ ಸುಪೀರಿಯಂಟ್ ಶುಡ್ ಸೂಪರ್ವೈಸ್ ಅದೆಲ್ಲದನ್ನು ನಾವು ಯೂನಿಟ್ 4 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. ದಟ್ ಮೀನ್ಸ್ ಸ್ಕಿಲ್ಸ್ ನ ತಿಳ್ಕೊತೀವಿ ನಾವು ಯೂನಿಟ್ 4 ಅಲ್ಲಿ. ಸೊ ಯಾವ ತರ ಸೂಪರ್ವಿಷನ್ ಮಾಡಬೇಕು, ವಾಟ್ ಇಸ್ ಸೂಪರ್ವಿಷನ್, ಹೌ ಇಟ್ ಫ್ರೇಮ್, ಹೌ ಡಸ್ ಫ್ರೇಮ್, ಅದನ್ನ ನಾವು ಯೂನಿಟ್ 4 ಅಲ್ಲಿ ತಿಳ್ಕೊಂತೀವಿ. ದೆನ್ Unit 5 Material Management. So, what is material management? How to manage the materials. ಅದನ್ನ ನಾವು material management ಅಂತ ಕರಿತೀವಿ. ಅಂದ್ರೆ ಸಿಕ್ಕಿರುವಂತ ರಿಸೋರ್ಸ್ ಅಲ್ಲಿ. So, we have some resources. How to manage those resources. ಅದನ್ನ ನಾವು material management ಅಂತ ಕರಿತೀವಿ. That we see in unit number 6. Then unit 6 is financial management, organizational behavior. So, what are the financial management? How to manage the finance. So, what are the organizational behaviors? That we're gonna see in the unit number 6. Yes. Next subject is Introduction to Nursing Research and Statistics. Research and Takshana Talagin Varthe, we are going to search something. Statistics means first comes to our mind, that is mathematics. We have some mathematic formulas, we have some mathematic problems here. That is Introduction to Nursing Research and Statistics. Okay, we have five. We have section A and section B here. That is one, we have research methodology, and the next section B is statistics. Okay. Okay, first let's see research methodology. So research ಅಂದ್ರೆ ಏನು? Research ಅಲ್ಲಿ ಏನಿದೆ? So this research mainly includes five subjects. Okay, sorry. This research mainly includes five units. Subject includes five units. That is, first unit is steps of scientific methods. So what are the steps in the scientific methods? What are the steps in comes in under the scientific methods? That is unit number one. Then unit number two is statement of research problem. So how to write a research problem? So research problem ಯಾವ ತರ ಬರೆಯೋದು? How to statement, how to give a statement of a research problem. ಅದನ್ನ ನಾವು unit 2 ಅಲ್ಲಿ ನೋಡ್ತೀವಿ. Yes, so after going detailedly into this unit 2, you will understand how to write the statement of the research problem. Then unit 3 is research approaches. ಸೊ ರಿಸರ್ಚ್ ಅಪ್ರೋಚಸ್ ಅಲ್ಲಿ ಹಿಸ್ಟಾರಿಕಲ್ ಆಗಿರ್ಬೋದು, ಸರ್ವೆ ಆಗಿರ್ಬೋದು, ಎಕ್ಸ್ಪೆರಿಮೆಂಟಲ್ಸ್ ಆಗಿರ್ಬೋದು, ಎಕ್ಸ್ಪೆರಿಮೆಂಟ್ಸ್ ಆಗಿರ್ಬೋದು, ಯಾವ ತರ ಇದೆ, ಹೌ ಇಟ್ ಇಸ್ ಫ್ರೇಮ್ಡ್. ಸೊ ದಟ್ ಕಂಪ್ಲೀಟ್ಲಿ ವಿ ಸಿ ಇನ್ ದ ರಿಸರ್ಚ್ ಅಪ್ರೋಚಸ್. ದೆನ್ ಯೂನಿಟ್ 4 ಇಸ್ ಸ್ಯಾಂಪ್ಲಿಂಗ್ ಟೆಕ್ನಿಕ್ಸ್ ಅಂಡ್ ಮೆಥಡ್ಸ್ ಆಫ್ ದ ಡಾಟಾ ಕಲೆಕ್ಷನ್. ಸೊ ಯಾವ ತರ ಸ್ಯಾಂಪಲ್ಸ್ ಕಲೆಕ್ಟ್ ಮಾಡಬೇಕು, ಹೌ ಯು ಗೋನಾ ಕಲೆಕ್ಟ್ ದ ಸ್ಯಾಂಪಲ್ಸ್, ಆರ್ ಇಟ್ ಮೈಟ್ ಬಿ ಇಂಟರ್ವ್ಯೂ ಮೆಥಡ್ಸ್, ಆರ್ ಇಟ್ ಮೈಟ್ ಬಿ ಬೈ ಎನಿ ಕ್ವೆಶನಿಂಗ್ ಮೆಥಡ್ಸ್, ಆರ್ ಯು ಕ್ಯಾನ್ ಕಲೆಕ್ಟ್ ಇನ್ ದ completely in the mass media. Through the mass media you can collect, or completely as a group you can take, or complete single means as a individual you can collect the samples. That is sample and sampling techniques, how you're going to collect, methods of the data collection, that is primary data collection, secondary data collection, and tertiary data collection. So primary ಯಾವ ತರ ಇತ್ತು ಅಥವಾ primary ಯಾವ ತರ, if you are the first person to collect the data, you will tell you are the primary data collector. So primary ಆಗಿರ್ಬೋದು, secondary if you are the second person, you are the, so primarily already a person has collected the data, and what else I need to collect. So what is the next step that you're gonna see in this methods of data collection. Then analysis of data. Tabulation andre ಏನು? What is tabulation? Have to do the tables means have to tabulate. Then communication of the research finding. So you're gonna communicate the what research findings is there. So have to find the researchers. So that you're gonna see, or how to research, that you're gonna see the unit number 5. Yes. Then B, section B is introduction to statistics. So what is in this introduction to statistics? The first unit is descriptive statistics. So what is descriptive statistics andre ಏನು? What is statistics? That you're going to see in the unit 1. Unit 2 is correlation. So correlation ಯಾವ ತರ ಮಾಡ್ತೀವಿ? So ಒಂದು ಪ್ರಾಬ್ಲಮ್ಗೂ, ಒಂದು ಸ್ಟೇಟ್ಮೆಂಟ್ಗೂ, ಒಂದು ಸಮ್ಗೂ, ಇನ್ನೊಂದು ಸ್ಟೇಟ್ಮೆಂಟ್ ಅಥವಾ ಇನ್ನೊಂದು ಸಮ್ಗೂ ಆ ತರ correlation ಮಾಡ್ತೀವಿ. That we're going to see. Unit 3 is biostatistics. You will see some crude rates, so we'll see some standard rates, some ratios, estimations ಆಗಿರ್ಬೋದು, based on the trends, estimations ಆಗಿರ್ಬೋದು, ratios ಆಗಿರ್ಬೋದು, rates ಆಗಿರ್ಬೋದು, that you're gonna see in unit number 3. Then unit 4 is introduction to computers in nursing. So what is the introduction? So computers, what is, why computers are necessary? Yeah, computers ಬೇಕು nursing ಅಲ್ಲಿ. So why? That we are going to see in the unit for introduction to computers. So what is computer? Why it is needed? What's the need? What's the aim? What's the purpose in nursing field? That we're going to see in the unit number 4. Yes, this was our ಕ್ರಾಶ್ ಕೋರ್ಸ್ ಫಾರ್ ಪೋಸ್ಟ್ ಬೇಸಿಕ್ ಬಿ ಎಸ್ ಸಿ ನರ್ಸಿಂಗ್ ಸ್ಟೂಡೆಂಟ್. ಐ ಹೋಪ್ ಇದು ತುಂಬಾ ಹೆಲ್ಪ್ಫುಲ್ ಆಗಿದೆ ಅಂತ ಅನ್ಕೋತೀನಿ. ಸೊ ಈ 9 days ಅಲ್ಲಿ ಇದು ಸೆಕೆಂಡ್ ಡೇ ಆಗಿದೆ. ಸೆಕೆಂಡ್ ಡೇ ಅಲ್ಲಿ ನಾವು ಪೋಸ್ಟ್ ಬೇಸಿಕ್ ನರ್ಸಿಂಗ್ ಸ್ಟೂಡೆಂಟ್ಸ್ಗೆ ಬೇಕಾಗಿರುವಂತಹ ನಾಲೆಡ್ಸ್ ನಾವು ಕೊಟ್ಟಿದ್ದೀವಿ. ಸೊ ಫಸ್ಟ್ ಇಯರ್ ಯಾವ ತರ ಇರುತ್ತೆ, ಹೌದು ಸೆಕೆಂಡ್ ಇಯರ್ ಇದೆ, ಸೊ ಯಾವ ತರ ಸಿಲೆಬಸ್ ಇದೆ, ಯಾವ ತರ ಸಬ್ಜೆಕ್ಟ್ಸ್ ಇದೆ, ಹೌದು ಕ್ವಶನ್ ಪೇಪರ್ ಕಮ್ಸ್, ಕೆರಿಯರ್ ಆಪರ್ಚುನಿಟೀಸ್ ಏನು, ದಟ್ ಕಂಪ್ಲೀಟ್ಲಿ ವಿ ಹ್ಯಾವ್ ಗಿವನ್ ಇನ್ ದಿಸ್ crash course in the second day. I hope you guys have got all the points. So thank you for watching. This was our today's crash course. Thank you all. If you want any detailed notes regarding this, you can follow our Nursing Guru. Even we have a Nursing Guru page, and please subscribe our Nursing Guru channel.